lives. And, we think back again to the COVID-19 pandemic, which is not so far back in our memories, how it really was a barrier that limited progress often in pushing forward to get ahead in combating the virus. Because what it really meant often was people were hearing information from multiple sources, and there was this loud noise of disorder and misinformation that people never always felt sure which was true and which wasn't true, and how and who to believe. So really, alongside dealing with what was an infodemic, the rapid spread of multiple false claims, the many doubts people had when we had the first vaccine, the multiple conspiracy theories that really undermined public trust, and the real consequences this had that made often people's need or desire to seek care. They may have ignored health advice and lost trust in the very systems that were trying to help them. But there were also encouraging examples of what worked. So, I'm thinking back in Nigeria where, civil society came together, health professionals, journalists, community leaders came together to really monitor the emerging threats and the rumors and respond in real time. And in some communities, we engaged, traditional leaders, local leaders who were all there to debunk misinformation in their communities using the multiple platforms that they had access to. And even digital platforms like WhatsApp, where we know misinformation and disinformation can spread so quickly and circulate at breakneck speed. So these were not isolated efforts. They're examples of really how a network approach can reach people more effectively and restore trust. And that's really the core of our conversation today. We need to move away from the idea that public health is simply about delivering messages from the top down. It's no longer enough to just broadcast the truth. We must shift away from the way information flows, top down, bottom up. Widen the tent for the multiple voices that can share information, and also recognize where and whose experience counts, and be honest about the kinds of knowledge that people actually trust. Because we know that we need to challenge a lot of these underlying assumptions that shape public health practice. And what we also need to stop doing is making assumptions about who people will trust simply because they may be labeled as experts. Even scientists, we saw during COVID-19, were questioned. The assumption that, yes, they are experts, and the assumption is they should be believed is the case. However, we must not assume that the public and people think that way. So there really needs to be a paradigm shift and how we make a lot of these assumptions on who is trusted, because trust is not automatic, it's often earned. So really today's webinar is more than just discussion, it's also a call to action, because misinformation is such a complex thing to tackle. It's fast moving, it's changing rapidly, and it's really rooted in emotions that are complex from one group to the other. So how people deal with information, how people address information, how people access information varies across the different age groups. And we have to also recognize that it's by using multiple voices, using the network approach, using different stakeholders. We need to work together across all sectors. It's not just for the health sector to tackle a lot of these health issues and health disinformation. We need to draw everybody together on the strengths that they have and how all of those connected efforts can really move us forward. And at Nigeria Health Watch, we've seen how collaboration can amplify the impact. And today really is about learning with the experts who you'll be hearing from, and one another working together and sharing what's worked and what hasn't worked, and really building stronger networks for the road that lies ahead. So with that, I'd really like to engage, to listen. As Kemi mentioned, please feel free to drop your comments in the comment section if you have questions. Likewise, there'll be a Q&A session. that would enable you to ask questions to our distinguished speakers today. So I really thank all of you for joining us today on this webinar. And we hope that this will be the beginning of a continued effort where we build these networks across our different countries and sharing the information we have and in using our various networks and leveraging them in whatever way we can to ensure that as much as possible, we find avenues and ways to ensure that health misinformation gets communicated, and also that when people access that information, that they trust the information they receive. So with that, I'll hand back over to our moderator for today, Kemi, who will guide us through the various sections. And thank you again, once again, for joining us. And I really look forward to the conversations we're going to have ahead today. Thank you so much.
Thank you so much, Vivian. Thank you for those very insightful words. Indeed, public health can't just be about dissemination of messages. There has to be a way to ensure a bottom-up approach to communications, to influencing behavior change. Now, to take us further, I'd like to introduce Professor Adam Kucharski, who is the co-director of the Center for Epidemic Preparedness and Response at the London School of Hygiene and Tropical Medicine. He has worked extensively on multiple outbreaks, including Ebola, dengue, Zika, influenza, and COVID-19. And his research focuses on understanding how social behavior and immunity shape the dynamics of infectious disease outbreaks and public health response. He has also contributed significantly to multiple editorials and thought leadership across both mainstream and peer-reviewed academic journals. So please put your hands together virtually, or just help me welcome Prof. Adam Kucharski as he gives the keynote speech on networked approaches to combating health information disorders. Hi, Prof.
Okay, thank you so much, and thank you for the invitation to speak today. So I'm just sending a request, so hopefully I can share my slides. There we go. I'd like to share some thoughts around misinformation and epidemic dynamics, some of the evidence available of what we're dealing with and where we can go. And so our focus of work is, like many others, infectious disease epidemiology and response, but communication has been a key component of a lot of our work over the years. And that, as people working in science, working in health, can take a number of forms. So, for example, there's traditional media, the work we've put out as press releases, interviews, documentaries I've contributed to, things like opinion pieces in newspapers. But there's also a much wider landscape of information out there that we can interact with. So, for example, social media, a very big one, particularly during disease outbreaks, putting information out there for people, and increasingly for COVID, saw others online reworking this as a post on Twitter that got reworked for Instagram, and these new methods of communication and for specialists to engage with wider audiences. We've also done a lot of work in person, thinking about things like workshops and events. So at the top here, we ran an event at the Science Museum in London, so with large numbers of people, getting them to think about how disease transmission chains work. At the bottom left, we've done work with schools, these kind of citizen science approaches where collecting data on behavior and getting students to participate in research projects. We also ran a large study with the BBC a few years ago where we got people to participate in this analysis of social behavior and interactions to help build up this data set for future pandemic, which turned out to come much sooner, I think, than we were hoping. But really a way of trying to engage different audiences and use these new approaches for thinking about how we communicate the work we do. But I think, like many others, there's challenges to doing this. I quite like this framework by Margaret Roberts, who's thought a lot about censorship and obstacles to information sharing. And she highlights what she calls the 3 Fs. So one of these is fear. And I think in the context of health and science, there can be a backlash against controversial topics, and that can make people fearful, perhaps, to engage in different ways. Flooding is another one. So just too much information. I think we often have that sensation. There's so much out there. How can we possibly make a dent in it. And then the final one is friction. That even if we're trying, the routes to get our message across aren't as effective as we'd hoped. And really that struggle to get from the evidence base through to the people who can benefit from that. So what I really want to do today is talk a bit about, first of all, the nature of the problem we're dealing with, and then second of all, what can we do about it? So I think like all kind of outbreaks, like all threats, understanding the nature of that threat is a really important first step. And when we work on infectious disease outbreaks, a lot of our work as epidemiologists focuses on the measurable outcomes of infections. So for example, we might have data on things like hospital admissions or case surveillance, or in some cases, asymptomatic screening for different individuals. And all of those give us some measure of what's happening shortly after infection. So obviously the more severe outcomes happen further away from the infection. If you see deaths or hospitalizations, those are affecting events that happened in the past. But of course, this isn't the full story. There are things that influence that risk of infection and what happens that aren't just those delayed outcomes. So one, for example, if you're talking about an infection like COVID or many other infections that are driven by the risk that your behavior shapes, if you understand that behavior, you can get some sense of the risk that was happening closer to that point of infection. So for example, if I ask you about your social contacts over the last few days, I can get some sense of your relative risk of exposure to certain pathogens that might be circulating compared to someone with far fewer contacts. So it gives us a measurable estimate of risk that's closer to that point of infection. But we can go even further back into the past. There's things that will predict risk that happen before you get infected. So things, for example, like vaccine status. If we know vaccine coverage within a population, we can make some estimate of what that future infection risk might be. But then, of course, vaccine status is influenced by things that happen before. It might be someone's attitude to getting a vaccine that might then influence whether they get the vaccine, which then might influence the risk. We also have things like policy changes. If we know that there's going to be a shift in how countries implement vaccination, in this example, again, that's something that we can then start to think in the future about what that might mean for an epidemic. And then if we go even further back, you get things like information exposure. So someone's attitudes to vaccines might be influenced by information interactions they're having much earlier. So if you think about it from the point of infection where the risk is happening, there's all of these aspects that are occurring upstream, really months, if not years beforehand, which are then going to influence what happens subsequently. So I think really important to look at this full picture and not just think of the epidemiological outcomes we see, but really all of these elements that shape the risk and the health behavior. So I think a really classic kind of clear example of this in health is something like smoking. So it's a nice plot from the other day from Our World in Data. The purple line here shows cigarette sales over time in the US, and the red line shows deaths from lung cancer. So you can see this really clear lagged outcome where you get a peak in cigarettes sales, and then obviously it takes time for smoking to translate to cancer, and you get this subsequent peak later that comes down after the exposures come down. So we can think about similar data that might give us prediction of infection risk when it comes to things like vaccines. This is work by the Vaccine Confidence Project at the London School, so a number of colleagues working on this. And this is surveys that look at different attitudes around the world. So this is the share of people who strongly agree or somewhat agree that vaccines are safe, and you can see a lot of geographic diversity across different countries. But again, this is something that might give us an indication of propensity to get vaccinated or how that might interact with policy. But you also have the earlier stage I mentioned of what's people's interactions with information that might influence that vaccine attitude. And this is where things get harder, because we're obviously moving further away from the events and the actions of vaccination and much more into the information ecosystem. And this is where we can get a number of hypotheses and views about information that may not always align with the evidence. This is a really nice paper, I think from last year in Nature, which challenged some common misconceptions people have about online information. I think these are things that we often see kind of given as broad views, but there's sometimes a bit more nuance to it. So one, for example, was this idea that the average amount of exposure to problematic content is really high. I think there was a survey in the US a few years ago that on average people thought 2/3 of what they saw was misinformation in the news. But that doesn't really align with what we see in data. So if you look at even vaccine skeptical content, somewhere like the US, the vast majority of that is consumed by a relatively small number of people. There's studies as well in other countries where they followed online behavior, and a lot of people engage with reliable sources in many cases. I'll talk a bit more about this in a moment. The second misconception is that a lot of it is really just down to the algorithm for the exposure. And again, there's a lot of features of these platforms, and some I'll talk about, that can contribute to some of these problems. But the idea that it's purely passive and we sit back and it's just the algorithm gives us all of this doesn't necessarily align with what we see. So actually, purely recommendations in some of this work suggesting that views of more kind of extremist political content and extremist views are really not just driven by the algorithm, and it's other aspects of kind of behavior and dynamics. And the final one is this idea that it's social media alone that's causing social problems like polarization that we're seeing around a lot of these issues, or that it's really the primary driver. And again, there's a lot of kind of emerging evidence challenging some of these ideas, and also just the way that the cause and effect might happen. So in some situations, people's consumption of media and how they interact online may be influenced by their outlook and their polarized views on some things, rather than it being the other way around. So it's not to say that social media and algorithms have no effect on this problem, but we shouldn't just jump to quite a simple conclusion. We should think about the complexity of what's happening, which I'll talk a bit more about. So just to highlight that first point about news consumption, because I think there is sometimes this idea that so much of what we consume is false. And this is data over time on visits to different websites. So here in green are the websites that are generally seen as mainstream, BBC, New York Times, these kind of established, generally trustworthy news sources. And you can see during COVID, there was more consumption of news. So it went from about 5-6 billion up to about 8 billion visits during the pandemic, and stayed quite high. In contrast, if you look at websites that generally aren't trustworthy, so these more kind of fringe conspiracy type websites, that's the little red bars here. So it went, from about 160 million to about 200 million, these little bands. But actually, if you go back to the previous one, it's a tiny, tiny fraction. It's about 40 times bigger in consumption of trustworthy content. So a lot of headlines saying untrustworthy website visits have jumped from 160 to 200 million. These figures look big, but we need to think about it in terms of the landscape of what people consume. And I'll talk a bit more about the potential impacts of that a bit later. So it doesn't mean this isn't a problem, but it's understanding the shape of the problem that we're facing. There's also a related challenge of just defining what we mean by misinformation. So I think it's a useful study from last year of vaccine-related content on Facebook. And it looked in early 2021, all of the posts that got shared more than 100 times. And what happened to those posts? So some were fact-checked, some were deemed false or missing context, for example. A lot of them just weren't flagged, or that they were sent and they were evaluated to be true. So you can see the vast majority weren't flagged for fact checkers, and you got some that were flagged as misinformation. So this is on a log scale here. So you can see it's in the billions at the top and then the sort of millions at the bottom. So I think it's about 0.3%, 0.4% of all the content was actually flagged as misinformation. So again, quite a small part of the information being consumed. But that's not the end of the story, because actually a lot of the information on the right-hand side that wasn't flagged as misinformation was examples like this. So this was a headline from the Chicago Tribune, which said that a healthy doctor died 2 weeks after getting a COVID vaccine. CDC, Centers for Disease Control, and the US are investigating. That is factually accurate. Those things happened. But of course, from that alone, we can't tell anything about the cause and effect here. These are just two events that occurred. We can't say anything about the safety of the vaccine. We can't make any general statements. We need a lot more information to understand whether the link is actually there, to understand from larger data sets what that might mean for a safety profile and so on. But this was widely shared. And links relating to this headline were shared over 65 million times on Facebook. So if you look at the graph on the left-hand side, this was actually 7 times more than all of the content that was flagged as misinformation combined. But it was being shared because there was this implication that there was something around the vaccine. Although that wasn't supported, you had this factually accurate bit of information being shared for reasons that probably didn't support an accurate view of what the vaccine was doing. So this is really one of the ongoing challenges with misinformation, that you have this relatively small, clear-cut, just false statements, but then you also have these things that are technically true, but perhaps not being shared for the reasons that are going to propagate true beliefs. So this is a kind of ongoing challenge in defining the shape of the information that we're working with. Another challenge we have in how things spread online is that they may not remain static. So it's a point I made a few years ago, that you can get, for infectious diseases, things can pick up mutations and they can change and evolve, and we can see the exact same thing happen with information. So a useful example of this a few years ago was a post on social media making this point about affordable healthcare. So it's saying, you shouldn't go broke if you get sick. If you agree, please post this. And it started getting shared, and then it started mutating. This post started picking up changes. So one change it picked up, for example, was saying, I think no one should die. So it's putting it in the kind of personal element. Another change was saying this kind of, we're only as strong as the weakest among us. So a bit more of a kind of general outlook in that statement. Others said, please do it in the next 24 hours. So giving some urgency to this statement. And what we can do is, much like a virus, we can look at how those mutations occur, and we can plot an evolutionary tree. So if you get lots of viruses, you sometimes see the evolutionary relationships of, are they in the same bit of the tree? Are they quite different? And much like a kind of family tree you'd see for anything else, you can look at how related these bits of content are by where they are in the family tree. So the original is this big bit of sharing in the middle. The I think that post is over here. You've got in the next 24 hours, we're only as strong. Then you see all these little other mutations that weren't quite as successful. So really this evolutionary story, and a lot of these mutations gave it more transmissibility. So it picks up the ability to spread more easily as it adapts. And what we see increasingly is, across the ecosystem of different platforms, these mutations pick up very, very rapidly. So one example in 2020 was a post about, it was a data issue in an election map, but was suggested that this was something going on with the election results, but actually it was purely just a data issue by one of the draft plots that had been published. So this was on just a kind of random fringe message board, and it got picked up, and people started sharing it in different ways. So over time, someone found it on Twitter, posted it with more of a kind of suggestive message that there was something going on, and then others started sharing it, more prominent people. This is, you can see, all on the same day. And eventually Donald Trump reshared one of the messages that had gone there. So you had something that started off as just an observation on a random bit of the internet, evolving and kind of picking up mutations in how it was presented before being extremely prominently shared a few hours later. So really this speed we're dealing with, very, very different to what we see perhaps in the past. So what can we do about this if these are the kind of problems we're facing? There's a lot of emerging evidence about different strategies that can be more and less effective for dealing with misinformation. So a systematic review that some colleagues did a few years ago looked at strategies around vaccine misinformation. And they found some things that the evidence suggested could be ineffective or backfire, things like scare tactics, or if you're overconfident and over certain in your statements. Things that were more promising were communicating the weight of evidence in what's actually out there, supporting, for example, things like vaccine safety, use of humor, and incorporating warnings that you might encounter misinformation in future, which I'll talk a bit more about. Things that had more mixed results, so trying to just simply debunk misinformation as it emerged, or just providing purely factual statements, where the evidence base was less clear that there was a consistent outright effect with that. And so that's evidence around what seems to be working, not working, but I think it's helpful to break this down into a bit more detail. I think much like a disease, we can think about the different things you might target for control. So if you've got misinformation or harmful content, there's different things you could do about it. So one is you could target the content itself. So if there's a post, do something about that post. So you can think of it from a disease, it's the equivalent of a treatment. You've got someone who's infectious, can you treat them? Can you isolate them to reduce that transmission? The second thing is, can you just target the opportunities for transmission in the population? So you might have the content out there, but actually, can you make it just harder to spread? The final one is, can you target susceptibility? So you might not want to have changes in people's interactions. You might not be able to stop all the content, but can you reduce people's susceptibility? And that's what we use vaccination, of course, for infectious diseases, that we don't have social distancing measures. We don't necessarily want to chase down the outbreaks. Ideally, we want to vaccinate, and that will block the spread from ever taking off. So let's just go through those options. So one, in terms of targeting the content, there's evidence, for example, that if people post something and a correction is issued on that content, it can either encourage them to delete it or reduce the ability of other people to share it. So a prominent example of this is on Twitter, now X, this idea of a community note. So here, for example, is a misleading claim about vaccines that was a few weeks ago. And they had this button on Twitter. So you can rate notes, adding context, saying, this is misleading for these reasons, here's the evidence. And then if there's enough votes, and what they do is they encourage rankings from people who previously disagreed. So it does, in the original design, try and encourage kind of diversity in who rates these notes. And then if there's enough votes, it gets added to the post to say this post is misleading or this post has additional context. And actually, if you look at evaluations of these notes that have been added to posts, particularly around vaccine content, generally they converge on quite an accurate representation of additional context. So if you have something that's misleading and people say this is misleading, for example, and add a source, analysis of a couple of hundred notes about COVID vaccines when this tool came in found the vast majority were accurate and often cited high quality sources. But as you'll notice on this post at the top, this is from a couple of months ago now, it doesn't have a community note on it because not enough votes were added to suggest that one was useful and had to be put on it. So it was spreading, but it hasn't had this correction added to it. And this is something we see in data. This is a nice analysis by Bloomberg recently, that if you look, for example, at how long it takes, so this is since something's posted, how long does it take to get a community note added to it? It's generally half a day before content gets something added. So in that time, something will have gone viral, it will have reached a massive audience, and then 12 hours, 24 hours later, you've got a post saying this is misleading. So it's one of these tools that in theory has promise, I think, but is generally just too slow an intervention. And it's there's an analogy there with infectious disease, that trying to chase down an epidemic is much, much harder than trying to get ahead of it before it gets out of hand. So what about the second one? Well, we've seen in recent years quite a few efforts by platforms in some cases to actually just change the ability to transmit. So WhatsApp, for example, after rumors created a lot of targeting of certain individuals and groups, actually changed the structure of the app. So you couldn't forward to more than 5 others. So rather than be able to forward to a vast number of people in India where these problems were happening, it just changed the structure of what you could transmit. Pinterest as well changed their search function. This was in 2019. So you wouldn't actually just get the organic search for content that you'd usually get. It would actually divert you to health providers and the information that they would have. So it's really disrupting the structure of the network and the app to reduce potential for transmission. The final one, as I mentioned, though, is susceptibility. Understandably, a lot of companies are very reluctant to change their fundamental business model and their app. So can we think about something that would reduce susceptibility to information when they see it? So one of these concepts is what's known as pre-bunking, thinking about kind of inoculation, that if you present people with not just a debunking of information, but the idea they may encounter information, this is what it may look like, how they can better evaluate whether things are true or not. There's been a lot of promising evidence this can help in resistance of misinformation by getting ahead of the problem. But there are some challenges here. So one, of course, is that if you tell people that there's a lot of misinformation out there, it may reduce trust in all forms of information. So you'll solve the misinformation problem, but you'll also solve the true information problem. So that's something where there's increasing focus at the moment in trying to allow people to separate between these things, because you get this kind of dual risk. And there was a study a few weeks ago, I think, that nicely highlighted it, that you don't want people to believe lots of things that are false. Equally, you don't want them to not believe things that were true. And what they found in this analysis of news consumption was generally they were better at saying false news is false than understanding that true news was true. So in other words, as an intervention, there seemed to be more room to help people believe more things that are true that they're not currently believing, than just stop believing falsehoods. So it's this trust element as much as trying to reduce existing beliefs. So I think really just to finish, a few suggestions that Heidi Larson, a colleague, published recently, which I think links some of this together, and thinking about the evidence base and some of the tools that we have available, is this element of trust and needing to get belief in true information. Thinking about those locally trusted sources, it was mentioned earlier, really understanding those links of where do people get information, where is that trust, why is that trust not in true information in some ways, and thinking about that become routes through that network. Second, greater science and media literacy. Just the volume and the complexity of information that people are being flooded with is much higher, and just saying these are facts and this is wrong is not sufficiently convincing for many people, and helping people actually understand what they're seeing, understand how to tell the difference, especially as a lot of these misinformation efforts borrow the language of science, they borrow language of medicine. So how can people discern between these? And then I think also making communications more resonant with audiences, that some of the communications we might use in health or in science won't be framed in a way that's useful and engaging. The point they made in this paper, for example, linking in with stories or personal links. Why should someone care or be interested in this as a topic and a piece of evidence can help, rather than just putting it out there as a series of cold hard facts. So with that, I'd like to thank you very much for your attention and for the invitation again, and look forward to discussions.
Thank you so very much, Prof. Thank you for that very insightful lecture, looking at the evidence base for health information disorders. And thank you for laying out some of the misconceptions that we have about how health misinformation spreads, as well as the role of technology platforms. It was very interesting to see what platforms like X, WhatsApp, and Pinterest are doing to help combat misinformation. When we get into the panel discussion, we're going to speak a bit more about that. What do we see the role of tech, or what do we think the role of tech in combating health information disorders would be? And then for highlighting, proven methods for combating misinformation, and showing us what the pros and cons are around debunking, inoculation, etc. And then, of course, the three proven methods that you mentioned at the end: locally trusted sources, making sure that health information is accessible, people understand it, it resonates with the lay audience. And then, of course, having better media literacy and science literacy as well in general public. These are all very poignant points to take home as we try to improve this work, and as we try to address this very complex Hydra-headed problem. So Sunday, I know there was supposed to be a brief music interlude, but is it okay if we just get into the panel discussion from here? So we can introduce the panel.
Yes.
Great. All right, so to take us further in the discussions, please allow me to introduce my esteemed panelists who will be joining Prof on the panel. First would be the Acting Director of the Health Promotion Division at the Ghana Health Service, who is Mrs. Mabel Kisiwa Asafo. She is a trained midwife, an academic, a researcher, and she has led numerous health promotion initiatives in her native country of Ghana. And I think that she has quite a lot of lessons to share on how she has tried to combat health information disorder in her country, leveraging community networks, etc. So please welcome her with me. Hi, Mrs. Mabel, can you hear me?
Kemi, can hear you loud and sound.
Oh, great. All right. Thank you so much for agreeing to speak. And secondly, please welcome the head of the Risk Communications, Community Engagement and Infodemic Management at the Nigeria Center for Disease Control and Prevention, Hajia Hanatu Bello, who is she is the one who leads the coordination of strategic public health communication strategies during outbreaks and emergencies in the country, leveraging structures at both national and subnational levels. And she'll be sharing her experience doing this in Nigeria. Hi, Hajia, can you hear me?
Yes, good morning, everyone. Thank you for having me on this platform.
Good morning. Thank you so much for joining us. So I would like to start with you, Hajia. And I mean, Nigeria manages an average of maybe 5 outbreaks annually. We get certain outbreaks every year, such as Lassa fever, cholera, etc. And Nigeria is also a very diverse country with, diverse communities, a very diverse geographical scope. So in your experience at the Nigeria Center for Disease Control, how have you worked to manage health information disorders, and what role do you think the networked approach can play in helping to strengthen that?
Thank you very much, Dr. Kemi. And I would like to extend my gratitude to Dr. Adam Pocheski for a well-delivered presentation. Thank you for this. Well, the Nigeria Center for Disease Control and Prevention, as you know, has the Secretariat for the Infodemic Management for the country. And this is a tall order. There's a lot that needs to be done with infodemic management when it comes to an institution, when it comes to an agency like the Nigeria Center for Disease Control. So usually I say that we cannot do it alone. It is not a one-man's business. You need a lot of people on board to do the job. And this is why this particular topic that was chosen for today's webinar cannot be overemphasized. We need a lot of networking because we can only do that much, So for us, we have community structures. We link up with the subnational to try to combat misinformation. We all know what happened during the COVID-19 outbreak, where the Nigeria Center for Disease Control was responding to the same misinformation, word for word, letter for letter, probably just the background coloring and whatever, being resurfacing a week or two after it had been debunked. So we've come to understand that just going out there and debunking misinformation does not do the job. There's need to do social listening. You need to listen online and offline, and you need to listen well. So there's need for us to have more dedicated infodemic management officers to handle both online and offline social listening in order to gather as much of the misinformation out there as possible and try to make sense of the situation and be proactive in either debunking or inoculating, taking into consideration the do's and don'ts and the challenges that could be faced with such approaches to respond to misinformation. For us, we reach out to our structures at the subnational and work together with them to try to see that we combat misinformation at any given time. Over.
Thank you so much, Hajia. Thank you for highlighting the importance of deepening roots and going as far within the communities as possible, highlighting the importance of multi-sectoral coordination and collaboration, and the importance of listening to communities, so social listening both in online and offline settings. So I see that there's quite a lot of questions for Prof after his presentation. I think that is excellent. Please keep them coming. But to help us track effectively, please put your questions using, or ask your questions using the Q&A function so that we don't lose track of it. And then just reserve the chat box for interactions, introductions, etc. I have seen a couple of questions already in the chat box. Hopefully I don't scroll past it. If the Nigeria Health Watch team, please help me with that so that we don't lose those. But please just use the Q&A function to ask the questions. It will be easier for us to track that way. Okay, so taking us further, I'd like to ask Mrs. Mabel a question. Can you share your experience in Ghana? What has it looked like managing health information disorders in Ghana? How are you building strong, cross-functional, multi-sectoral, robust platforms to tackle health information disorders? And what are the lessons that you've learned? How can that be improved on? What are the challenges you've experienced? How have you tackled those challenges? And what can other countries learn from it? I realize it sounds like I asked you lots of questions, but I'm sure you get the gist of it.
Yeah. Thank you very much, Kemi. Thank you, Dr. Kojechi and Hajia, for your presentation. And thank you for the opportunity. Yes, in Ghana, for us to be able to build and maintain a robust cross-sectoral network to combat decentralized health information disorder, I believe that a multi-layered approach is needed. And this includes multi-sectoral collaboration, just as Ajia mentioned. And this includes establishing formal partnerships between government agencies, healthcare institutions, media organizations, and community leaders to ensure a unified approach to health communication. And I must say that in this regard, Ghana is far advanced by establishing this collaboration mechanism in all our 16 regions, and not only in the regions that have also been extended to the 261 districts. And I think that in this regard, what we need to do is to ensure that these systems that we have built or these structures that we have put together are really functional. And if it will be functional, then it means that we have to resource them and then provide the needed guidelines for them to work with. And that is the hurdle that we need to cross. Again, we need to develop a digital health strategy. And I must also say that Ghana has a digital policy that gives direction on how digital platforms should be leveraged to improve information dissemination, making sure that we adhere to the ethical standards that goes with it. So leveraging on these policies that is available to us, I believe that there is, and it is important to develop a comprehensive intersectoral digital health strategy so that we'll be able to integrate technological-driven solutions for real-time monitoring of information disorder, which will also help in providing feedback to the people. So this strategy that we need to develop should actually spell out the level of decision and role of all the stakeholders. And I think that this is what we need to do. So once, yes, the policy is good to direct us, but then we need some intersectoral strategies to be able to guide the people as to how to go about it with specified rules for all stakeholders. Again, we also need capacity building. We need intersectoral collaboration, and these people must have the capacity to be able to work. So we need training of professionals across health sectors on misinformation detection and response strategies to ensure a coordinated effort. And I believe that this has been the focus of Ghana since 2020, because we have collaborated with partners. Notable among them is WHO, UNICEF, Packspace, Ghana, USAID, CDC, Ghana Net, and other stakeholders to build capacity of various officers across sectors, including media, on how to manage rumors to ensure a collaborative effort in misinformation and disinformation management. Again, we also need to work with some bodies and regulatory bodies and security bodies to also enforce our policy framework. And we have been working with bodies like the Police Service, the Food and Drugs Authority, and the Ghana Journalists Association. These type of bodies, they have some policies and they have some regulations that prescribe punitive measures if anyone should infringe on any of these policies, as well as health information dissemination. And so I believe that working with them will properly disseminate these laws and policies to the public, will improve awareness and hold stakeholders accountable for misinformation. We also need to do community engagement. We need to ensure that people on the grassroots in the communities are well empowered and their capacities are built to be able to support misinformation work across all levels. And so involving local health workers, NGOs, and traditional leaders in health education campaigns will help in a great deal to do this. And this is what we are targeting. Of course, I know that all this collaborative work that we are doing all cannot be done without some challenges. It all comes with several challenges. But there are also some nice and good solutions that we can have that will help us to be able to forge ahead and be successful in misinformation management. And this includes different sectors often operating in silos. These are some of the challenges that I'm talking about. Sectors are working in silos. When it happens like that, it makes it difficult to share information and coordinate efforts effectively. Again, limited resources. If you don't have the resources and infrastructure, it can also hinder cross-sectoral initiatives, especially in health education, in other areas and all that. And then also inconsistent policies across sectors can also create barriers to collaboration and also slow down progress. So we need to be consistent in what we are doing, policies shared together with all stakeholders, and then there's a common understanding. There is also the need to have trust and accountability. We need to trust each other. Where there is no trust, that is where we don't get the collaboration. And so some stakeholders may be hesitant to collaborate due to concerns about transparency and accountability. But then where we all have a common understanding and also build trust among ourselves, we will be able to forge ahead. Again, some key challenges could be unequal access to digital tools and data sharing platforms that can limit effective collaboration. I believe that these are some of the challenges that we can face. If these things are available, it makes it not easy. However, where there are challenges in access to some of these platforms, it becomes difficult for collaborative work to go on successfully. So I believe that I think the question was to look at insights and then some of the key challenges. But also there are some solutions that we can also look at, possibly maybe some potentials that we can look at in terms of collaboration by establishing something like a centralized digital platform for real-time information sharing and coordination, so that everybody is aware of some of these things, and then we can all know what is happening in terms of the space, information space, whether there's misinformation or disinformation, then we'll all be able to deal with it collaboratively. Then encourage collaboration between government agencies, private sector players, and civil society to pool resources and expertise together. I think these will help a great deal for us to be able to work collaboratively to solve information issues. And then develop cross-sectoral policies that align with national development goals, and then also ensure consistency in our implementation goals. And then train stakeholders. Capacity building is key, as I mentioned earlier, as some of the insights we have seen. If we train stakeholders, they will be empowered to also be able to have every tool that is needed to work effectively. and then also involving our local leaders and grassroots organizations to build trust and ensure that initiatives are inclusive and sustainable. So in a gist, I think this is what I can say about the insights, the key challenges, and the potential solutions to address this intersectoral collaboration. Thank you.
Thank you so much, Mrs. Mabel. Thank you for running through all of that. Thank you for sharing your experiences in Ghana and for making such excellent recommendations on solutions to strengthen this work, such as having a centralized digital platform for cross-sector information sharing, ensuring that we have cross-sectoral policies, giving all of the different parties that you mentioned. You work with the police, you work with media, you work with a broad range of stakeholders, and having mechanisms to coordinate and manage across all of these sectors will be critical. And that's why we're talking about the networked approach. So there are lots of questions in Q&A already, as well as the chat box. But before I delve into those questions, I'm very mindful of the fact that we have about 30 minutes left for this webinar. I'd like to ask you, Prof, one quick question before I allow the delegates bombard you with a lot of questions that they already have for you. And it's about technological companies, technological solutions, social media platforms. What are your thoughts on how we can work with these organizations and these platform owners to make whatever changes need to be made? I was really excited to hear that the X platform has that feature that allows you to put a community note in, but then it doesn't show until 14 hours later, by which time whatever information has gone viral. And as a matter of fact, one of the delegates asked a question about this already. She's wondering how that is an effective method, because it really isn't. But you mentioned what Pinterest does, for example. You mentioned what WhatsApp has done, allowing you to forward only to 5 groups at a time. Pinterest has streamlined their search function, and they just provide the evidence. What additional thoughts do you have on how algorithms can work better for this? How the research community and implementers and government agencies can collaborate with technological companies to make the information space, the information ecosystem safer?
Yeah, thank you. I think that's a really good question, and a lot of the good points raised more broadly as well. I mean, I think one big transition we saw, I think, in recent years was just more companies doing this. So the examples I gave in 2019, this was quite rare. And I think I was always quite skeptical that it would get implemented more broadly. But for COVID, we saw widespread disruption of particularly the search function. If you search for vaccines or search for COVID and a lot of these things, you'd get, WHO or local news or local kind of health agencies prioritized over the top of that. So I think in a way that was quite a good example, as has been mentioned, rather than having to chase down content, actually upfront disrupting people's interactions with platforms in a way that allows them to kind of access something useful ahead of time in what they're dealing with. I think what we've seen, particularly over the last year or so, though, are companies, in my view, wanting to take less responsibility of having to discern what's true and false. So I think one of the appeals of community notes, I think what other platforms are starting to take it on as well, is to some extent you can outsource that problem to users. That if you have fact checkers and if you're the ones putting kind of warnings on content, as an organization, as a platform, you're taking some responsibility for that. And there were, as with all these things, some examples of errors during COVID where there was like a Cochrane review for a treatment that was correct and it got flagged as misinformation, for example. So I think although there's evidence that it can work quite well as a tool, I think the reasons it's being implemented is much more for kind of responsibility one than that kind of power. I think the other big challenge we have, and it's not just for social media, you see it if you look at even contagion in financial systems, you look at, biological viruses, that often the most effective way of disrupting transmission is disrupting interactions or disrupting parts of a network of how things are linked together. And that's something that is actually quite disruptive for people, and there's often quite a lot of reluctance to do. I mean, I think in an ideal world, we'd just make social media slower and make, and add a bit more friction. I mean, someone mentioned AI in the chat, even if someone was posting, having those steps where it kind of, slow down. Are you sure you want to post this? This is what the evidence says. All of those bits of friction, I think, could really help. But I think because companies incentivize speed and shareability, And we even see now, for example, X increasingly downweight links. If you post a link on X, your post generally won't go as far. So if you imagine good evidence-based content is getting downweighted, and kind of images and things that are much catchier are getting incentivized. So I think for me, in terms of what we can do to try and incentivize this, I think finding ways where things can have impact without being kind of over ambitious in trying to get people to transform their business models, I think is the kind of helpful way of doing it. So for example, thinking of those topics where there are those examples of being able to preempt information, is that something that it doesn't feel from their perspective that they're taking too much of a judgment on specific pieces of content? I think prioritizing our attention on trying to get movement on those levers could be very helpful. I think what, for example, WhatsApp did in changing sharing, I suspect other platforms just wouldn't want to add that much friction for users. So I think, targeting our attention on things that we think will have more effect and are perhaps a bit more attractive to platforms as something they can implement.
Yeah, thanks for sharing that. It does seem like a significant problem, and coming up with solutions, I think, will take a while. And I like your take on it. Let's not try to change people's business models. I know Facebook announced, I think it was earlier this year, something about how they were downgrading, they were scaling down how much access they give to fact checkers. It was something about reducing the influence of, because initially during COVID, there was this big push, right, to give fact checkers and fact checking communities more visibility, but then that has been toned down a bit more recently. So target attention, target the audiences. It will take a lot more resources to try to target the companies and working with them. Okay, that's noted. There's a quick question for you. I think I'll just go into the chat box and the Q&As now and just pick some questions. I think you've already addressed a few of those. You started to address this one, but maybe you could speak to it a bit more. She says her name is Ruth McGee. She's a misinformation analyst in Toronto. And she's wondering if you have thought about how to disrupt the spread of health misinformation before it reaches political influencers who help push it into the mainstream when they reshare it. For example, Trump.
I think that's a really big problem. And I think one of the things that I've realized over the years is that a lot of the groups doing this have an extremely good understanding of how things spread online, and possibly a much better understanding than a lot of the groups working to try and get evidence out there. And there's a lot of these tactics. So one, for example, is known as astroturfing, which is basically where you create the illusion of grassroots support for an issue online, because you kind of, you have if you're a politician, you're a leader, you see so many accounts around you talking about something and posting about something, it gives you the impression that that's kind of a widespread consensus. But it's all engineered, that it's not actually particularly a popular belief, for example. So I think trying to understand the tactics that are very commonly used, and like I showed, reconstruct those outbreaks. And in some ways, either thinking about how those can be slowed down or they can be preempted. So one of the things that I often did quite a lot during COVID was where you could, for example, around vaccines, you could predict to some extent some of these questions that might be coming up, was trying to essentially get information to take off that would be there, in politicians, in journalists' news feeds before what I suspected was coming behind in terms of misinformation. So I think the more we can think about that ecosystem of, why does that? None of this is fluke. It's a lot of work going into engineering the spread of some of this content. So understanding the mechanisms they use. Another one that's very commonly used is engagement with media to try and get some credibility. So, often if you see a piece of misinformation, it won't be from a random account. It's because it's got to someone who will share it, perhaps not realizing what that content is. So I think in some situations, it might be quite hard to prevent that, but I think all of us can do work to think about, are we inadvertently part of that process? So for example, if you've got a piece of content which is they're just trying to generate attention around it, are we actually contributing to helping that spread, because we get outraged about it, we get angry. Are we actually amplifying the problem rather than helping suppress it? So I think for me, that's a kind of, again, understanding particularly how these groups get these things seeded and how we can slow them down, but also thinking about our own actions and are we inadvertently creating spread. I mean, one example, in an extreme way that happens sometimes is, you know, when you have these horrific attacks and you have people who have a manifesto because they've got some extreme beliefs, and then journalists publish the manifesto, and you're like, you're doing exactly what that person wanted in terms of getting their message out there. And so there's now a lot of guidelines for how, you know, like you shouldn't report on certain health issues in certain ways, for actually that kind of extreme content, being very careful to prevent follow-on spread. So I think there's a lot we can learn from those.
Yeah, I agree. And before I let you go and move over to Hannah, I mean, something happened recently. The Ministry of Health announced a new policy that was getting a lot of traction. And then there was a religious leader who said certain things that were not entirely accurate. They were accurate, but presented in a way that would help undermine that policy. And then the Ministry of Health responded with a really long, very accurate, well-written response on the X account. And then I went to the comment section and I just tried to read what people were saying. And what came out clearly to me were three things. One is, how do we communicate outside emergencies and outside major communications objectives? Like maybe it's a new policy released for a certain health behavior, say salt reduction or exercise or something. And that is linked to the question, one of the questions in the Q&A box. So how do you manage communications in those times in a way that you maintain trust, so that when a spokesperson or a government agency is all of a sudden speaking, when they've been quiet for so long and no one is used to hearing them speak, it doesn't arouse suspicion. Then the second thing was, how do you adequately ensure that you listen to people? How do you factor all of these sentiments and public sentiments in peacetime, like we like to call it? So that's linked to the question, the very first question in the Q&A box. So what strategies should be adapted, or would the strategies that are adapted during emergencies to counter misinformation be different from those that are adopted at peacetime, given the urgency? And that would be my question for you. Another question for you, Prof.
Yeah, thank you. And I think, I mean, I guess one of the differences with an emergency is just the attention on a problem and the potential for amplification. You know, during COVID, things that were coming out in terms of statements from scientists were just the amplification through media was much, much larger. But I think like a health risk, I think we can do a lot in terms of preparedness. I mean, I think one thing that was striking, I noticed during the pandemic, was not just the kind of official announcements, but actually a lot of extremely good communicators within health agencies or other organizations became quite well known as individuals. So, for example, in the UK, we had a number of people who worked for health agencies, but were just very good at communicating and became quite trusted deliverers, because this is a person, they're trying to do their job, they're trying to be helpful in terms of health. And in many ways, what they did got far more spread than some of the official announcements. I think the challenge, though, is, like with all preparedness, having that, you know, keep going is difficult. And I think also it's, for a lot of those individuals involved, it's quite a tiring role, particularly if it's not very well supported. So I've noticed that a lot of people now are just much more reluctant to engage in those kind of communication roles, just because it's the fear I mentioned at the start and a lot of the kind of hostility that comes around it. So I think, I mean, you mentioned kind of trusted messengers. I think having almost those groups of individuals who know their topics really well and have thought about how to communicate effectively. You mentioned listening as well. I think that's really important to understand the nature of what we're dealing with. You know, often around vaccines, I think you have a very small group of people who have conspiracy theories and very kind of extreme beliefs about it. But actually, a lot of people I've talked to, you know, have reasonable question. Why are there suddenly so many more vaccines in the vaccine schedule? Why should we trust the data from a pharmaceutical company? Those aren't necessarily conspiracy theories. They're people who want to just know more, and I think experts can do a lot to help support that. So I think for me, it's having people who have thought about communicating in a way that really addresses the nature of the beliefs that people have, and like with any kind of epidemic preparedness, being able to have those individuals that people turn to and trust. And there's a lot of great people out there online that do their work, great people within communities, but ensuring that they've got support, because this work isn't easy to do over a prolonged period of time.
Yeah, absolutely. And you're right. One of the past, I think it was Hadja, no, I think it was Mrs. Mabel who said funding is critical. Resources are limited. How do you maintain all of these structures when there is no real urgency for it? How do you communicate the urgency to the funders? And it's also not very easy to see what the results are, because how do you measure that someone's perception or someone's behavior has changed because of all of these investments that have been made? So yes, definitely things to think about. So I'll come to you, Hajia. There's a Nigeria-related question here that I think you should speak to. Actually, and there's another question directed at you. So if you could address both of them, that would be great. The first is, so in religious countries such as Nigeria, where the words of evangelical leaders, this is also linked to what Prof was just speaking about, where the words of evangelical leaders carry weight and probably reach a significant proportion of the population, is there any evidence of what works best in such situations? And then someone wanted you to tell them more about some of the social listening tools and approaches that your team is using in Nigeria for both online and offline social listening. So if you could address these two questions in about 3 minutes, that would be great.
Okay, so let me start with the issue with religious leaders. Well, we need to look at we need to acknowledge the fact that people's perception of situations, people look at situations from different perspectives, from different angles. In order to maintain and sustain trust, you have to understand the angle from which different people are coming from. That way, you are able to address the situation and you still, in a trustworthy way, and you still maintain their trust. So for us, we try to use data to address the situation without bringing in emotions, without trying to convince the people by force. And then we carry these people along. From inception. We try to engage with the communities, with those concerned. Religious leaders are some of our stakeholders. In fact, we have between 60 to 70 stakeholders with regards to risk communications, community engagement, and by extension, infodemic management in Nigeria. And we are working with all of them, trying to communicate, engage them to ensure trust, sustain trust, and address issues together. Then when it comes to tools that we use, well, at the NCDC, we have the event-based surveillance where we have the early warning system. From here, we are able to interact with community people. We pick up rumors from this angle online, from this angle. We have our ICC also, where there's a rumor section where we are able to also pick up some things. And then we have people listening even online. We are on social media platforms looking out and collating information on what people are saying with regards to whatever issue, either disease outbreak or situation we are concerned with at any particular point in time. And then for offline, we have our health promotion officers, we have our WHO focal persons at the community level, we have the volunteers at the community levels, we have even our LGA health promotion officers at the LGA levels, and from them, rumors are picked, issues are raised, and we even have a tracker which is shared with our HPOs, for some of these rumors that they pick from the community to be logged on to be keyed into and then sent to us, which are expectedly analyzed and then simplified, we quantify, and then we try to see how information can be escalated for proper decision making. I hope I've answered your questions.
Yes, I think you have. Thank you so much, Hajia. Thank you for sharing those thoughts on how you currently listen to your communities, remote logging, remote tracking, and your thoughts on religious leaders. I think having or just cultivating those relationships ahead of time and having this critical mass or large numbers of champions in those circles, I think are very key ways to help tackle that. So, Mrs. Maybell, someone has a question for you, and she says, and it's Lucia Arana, she says, trust is quite key. And we have seen that trust in government messages is not high as we would want it to be. So what's your experience in Ghana, and how have you been able to improve public trust?
All right. Thank you. So, yes, trust is very, very key, as you said. That is why it is important that at all levels, we are able to identify people and train their sources of trust. I believe that at all levels, at community level, people have their sources of information, and they believe that health workers or religious bodies or traditional leaders are their source of information. And these are the people that live with you. And so whatever they say, some also believe in champions, some also believe in what they hear from the media, some believe in what they hear from their pastors and things. So that is where the collaboration comes in. We need to identify all these people and build their capacity. As and when whatever information we have in the healthcare message intervention, these people must be able to get the needed information so that it can also be passed on from them to their followers. And when they get the right information, that is where they will be able to also really equip them with the needed information. Then they can take decisions about it. And when the right information is provided, whatever comes in as misinformation, they'll be able to identify it. And it's also very important that we also provide timely information. Immediately there is any misinformation, when there's any intervention, the information must go first. Sometimes we wait and the health education does not go early enough before the intervention comes in. And that is where there's a gap. You could hear other things or other people filling in with other information that is available to them. And so first we must be able to give first-time information and accurately and timely, very, very timely, so that they will get the best before other things come on. And they will say, oh, because I have the best, all other things that are coming are not right. It's different from what I have heard already from the trusted source. So good, we need to do the trusted source. So in Ghana, we identify these people, we identify spokespersons to build their capacity. So whenever there's a need or any new area, a new intervention, we train spokesperson, we train the media in any new thing that comes up so that we'll be able to provide a responsive reportage into the public, because people are also listening to them. Whatever it comes out of the media, is kind of, they believe in it and then they work with it. So we train media, we train spokespersons, we train all resource persons in their various regions and districts, making sure that they have the right information to provide to the people. And I think that's what has helped in getting people to build trust in health workers and other leaders.
Indeed, yes. So leverage trusted voices, ensure that you provide accurate and timely information so you can get ahead of the misinformation. Before you go, Mrs. Maybell, there are two questions here I'm going to combine for you. One was, what have your responses been in tackling vaccine hesitancy in Ghana, particularly in re-emerging vaccine preventable diseases in situations where the diseases have been controlled previously? And then someone also asked the question I think you should tackle together. And then if any other panelist wants to weigh in on that too, that would be great. So this person, Cynthia, says, if scare tactics and too much confidence can push people away, how do we talk about vaccines in a way that feels honest, respectful, and still convinces people, especially in communities that already don't trust the system?
Mm.
Feel free to
Okay.
start with the first one because the second one is like a
Okay. So yes, vaccine hesitancy has been a major problem when it comes to, especially it went very high when COVID-19 pandemic occurred, and this is where we actually try to find out what is the people's problem. I think that before we will be able to solve this problem, you should know where the problem is coming from and what people are thinking about the problem. So we really did kind of survey to assess people's perception of what they are afraid of. I must put it in quotes. So what is it about? Why are they not taking it? And that gave us a lot of insight about what people think about it in terms of they are afraid of the side effects. People have all this misinformation that we know about with regard to COVID had come up. So people were really not certain. And God was also new. People were like, it is new. We are now studying it. At this stage, pregnant women are not included. We are now studying. We want to now see how. So let's give to this age group, these people, health workers, frontline workers, and all that. So messages were then being given. So people were a little bit not certain about what it is. And so it is important that we find out what their perceptions are with regard to the vaccine hesitancy, and then we'll be able to build on that. So when we're able to get inside, people thinking that it will cause impotency, people thinking that they will die in some years to come when they take it and all that, it helps us to come sit down and then say that, okay, these are what the people are thinking. What can we do to kind of disabuse their minds of these things? So we now think about it and look at other things, other vaccines that have helped over time, that has eradicated some of the mostly childhood diseases and all that, just to cite them as an example to them, then people who have also gone through those things. And then we educate them on the benefits of the vaccination, and then also we target key people who can also influence in terms of they also taking the vaccine and then testifying. So kind of like satisfy people or who have taken it and they have not experienced what people think would happen to them, also coming out to testify that, oh, this is how it is. And sometimes even took us like coming up with Director General of Ghana Health Service coming to the public space to talk about it, and even the president of Ghana to also come in to take it and then also take the first jab, just to kind of make it as an example for people to know that what we are bringing out there is not just poison, it's for all of us, and then it's good for us just to prevent diseases, so that people will now know that it is important that we have to take it just for the sake of the population. And then we also felt that it was good to also engage people very well, kind of using some other communication like interpersonal more than the mass media. We felt that sometimes the mass media were not quite enough. We should also add interpersonal communication, and that one helped a lot. Targeting certain groups of people, associations, some small groups of people, and then getting them educated on the vaccine and providing the service also worked very, very well with us. And I think that is some of the things that we also, it helped us to be able to address the vaccine hesitancy. So I don't know what's up aside all the questions.
Yes, you have. You have. Thank you so much. I'm very mindful of the fact that we have 1 minute left. But before, so thank you so much to everyone, to all of the delegates. The engagement is amazing. We have so many questions. Unfortunately, we can't take all of them. But I wanted, Prof, if you could maybe speak to, I'm trying to figure out which of the questions to ask you, so that can be the closing thoughts that you then have. And so I know you glossed over the AI thing earlier when you were speaking, but someone had asked if AI would be useful in countering misinformation, and if you have any experience of this, you could share. But then there was another question that was asked much earlier. Santosh wanted you to share your thoughts on the adoption of pre-bunking misinformation inoculation interventions by public health stakeholders and its potential to be scaled up in the future, and what the barriers to scaling up would be. So if you could tackle these two questions in 2 minutes.
Sure. So I think both of those are kind of quite exciting areas. I mean, I think AI, there's been some nice work over the last year or so from a number of groups showing conversations with AI can help reduce belief in misinformation around certain issues. I think they're focusing on things like climate change, but in a way, there can be value to what feels like quite a neutral platform. It's not someone who disagrees with them trying to convince them, but you've got this, ChatGPT quite neutral situation. So I think for things that are particularly more factual, I mentioned earlier, even I think having something that could just provide additional context if you're going to engage with misinformation very rapidly, at least then gives a bit more ability rather than someone else having to kind of come in and do it manually. I think one of the dangers and what we're already seeing on some of these, particularly like Grok, which is the AI that's embedded within X, is there's modifications being made to the AI so politically it aligns better with certain beliefs. So I think you can get this thing where people are going to get AI to move away from its perhaps training data on health websites and move towards other things as well. So I think that's promising, but that's maybe only for a period where we kind of trust or have some understanding that AI that doesn't kind of have very strong kind of political slants at this point. And the point about pre-bunking is it's really how these things can scale. And I think one of the reasons that vaccinations are just such a good health intervention is because we don't have to try and chase down outbreaks in the same way, and we don't have to have these huge disruptions to our social interactions. And so I think for me, identifying those interventions that we don't have to be really reactive and pour a lot of time into in the moment, but we can actually plan more ahead of time, have those resources are the really valuable ones. So whether it's thinking about AI to scale interventions or whether it's thinking about giving people the tool and the mindset to reduce their susceptibility ahead of time, I think, as we know from real life disease outbreaks, getting ahead of things and thinking about how things can scale is really the key components.
Yeah, thank you so much for those thoughts. Thank you. Honestly, there are questions in the Q&A that even I want to know. Even I would love to ask, but we're completely out of time. But I see a reflection here from Elodie at IRA, and she's thinking about funding, given how misinformation is being propagated now and the current funding context, with withdrawal of the US, etc. Are there opportunities for us to collaborate with other sectors, even misinformation and disinformation more broadly, more generally, beyond health, in order to plug some of these gaps? Those reflections are very spot on and noted. And a lot of the other questions, thank you so much for your engagement. We will try to see if we can put out these responses on our platforms and engage more with the speakers and get you responses that you can have. This webinar is not one-off. There will be more of this coming up, so please look out for it. And that will be it for me as your moderator. I'll hand over to Sunday. Sunday, over to you.
All right, thank you so much. Thank you so much, Kemi, and thank you all our panelists and keynote speaker for that very engaging session. I believe the conversation shouldn't just end because there are a couple more questions, so we'll leave this meeting for a while. If our panelists can kindly respond to some of the questions, we'll be glad. And then the conversation will still be going on our Twitter, now X handle, so kindly join in on that. So you can follow us at Nigeria Health Watch for our X handle, and we also have the Health Fact Checking Twitter handle, X handle now, and it's at Health Fact Check NG. So kindly continue the conversation there. So before we draw this interesting webinar to a close, we have a few just surveys for us to fill. So it will be coming up very shortly. First of all, the first one that you kindly see here is we are currently mapping out stakeholders that will join a health information disorder management network. It's a network of collaboratives where we hope to build people who are actively addressing health misinformation at their various spheres of influence. So the link that is now on the screen with the QR code, you can kindly just use your browser. It's a short link that you can just indicate your interest in either joining or not joining our network. I want to encourage all of us that the network is really an avenue where we can work together collaboratively. Part of all the insights that have been shared today all point out to the fact that collaboration is the key thing that we need to do going forward, both regionally and even nationally. So I encourage all of us to kindly just indicate your interest by clicking on the link or scanning the QR code. This will also be put in the chat box because I would like to move on to the next one, and that's the post-webinar survey. And it's just for us to help us share your thoughts around how we can improve our future webinars. And we hope that you kindly take out some time to fill this. All of this will actually be shared as part of our post-event pack that will be shared with all our participants. So, but we encourage you to fill them now while we are on the call because they are really very short, open questions that you can just address. So thank you so much. While we are filling the form, we will just allow for a short music interlude, and before I come up and call Kemi for the closing. So. Okay, so I think we're having a bit of technical issues playing here, music in the background, but I think I see quite a number of people have already started filling the surveys. Thank you so much. And I see some concerns around whether we'll be sharing the slides. Of course, at the start of the webinar, I mentioned that we'll be sharing all the slides and also the recordings as well. So just watch out for your emails. Like I said, follow us on our handles and keep in touch with us. We'll be following up with further information. So thank you very much. I would like to invite again Emmy back on for her closing remark. So over, Kemi.
Thank you so much. Thank you very much, Sunday. Thank you, everyone. I don't think there's any additional thoughts per se. Just to say a big thank you to all the delegates and the speakers. Prof. Kuchaski, thank you so much. Hajia Hanatu and Mrs. Mabel, thank you for sharing your thoughts, for sharing your experiences, your expertise. It's been very insightful. We were only able to get through half of the questions in the Q&A, but we will continue to engage on this platform. So just like Sunday has said, follow us, join the network. Please share the link. Actually, the link to the survey is not in the chat box yet. So Sunday, if you could please put that there. There are a couple of requests for the link to the feedback survey. Please put it in the chat so people can click and share their thoughts. We live for your feedback. It helps us improve our work and improve the delivery of the next one, which will be soon and will be communicated across our platforms. So follow us. Thank you, everyone. Thank you to the speakers, and have a great rest of your day.
Thank you, Dr. Kemi. Enjoy the rest of your day.
Thank
Bye,
you,
everyone.
Kemi. Bye.
It's been a pleasure for you. Anytime, babe. Anytime, babe. Anytime.
Get new DJ mixes every day on umdundo.com.
brighter day and the sun stays away. Take heart in a new tomorrow. A little more love between makes for a brighter day. Never need worry, let one love set you free. One love, keep us together. Living in a world, it's a struggle to stay alive. One love, keep us together. Living in a world, it's a struggle to stay alive. Somebody tell me, oh, why we fight it? One love can set us free if we just let it be. Take love in a brand new day. Good love is all we need to take the clouds away. Never need worry if you just let it be. One love, keep us together. Living in a world, it's a struggle to stay alive. One love, keep us together. Living in a world, it's a struggle to stay alive. You never need worry, no, no. Let one love set you free.
Get new DJ mixes every day on umdundo.com.
Don't be sad, understand. Everybody has a day and the sun stays away.